Another study suggests an increased risks of heart attacks from eating a low-carb diet. And one Twitter profile proclaimed, "Finally good science," with an exclamation mark at the end. So is this the conclusive evidence that keto causes heart attacks? No, it's not even close. Instead, it's another example of low-quality evidence that doesn't meaningfully contribute to our knowledge about ketosis or true low-carb diets. So let's get into the details. Welcome to Metabolic Mind, a nonprofit initiative of Bazooki Group, transforming the study and treatment of mental disorders by exploring the connection between metabolism and brain health. Thank you for joining us on this journey. Before we get into the details of this study, please remember our channel is for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. Many of the interventions we discuss can have potentially dangerous effects if done without proper supervision, so consult your healthcare provider before changing your lifestyle or medications. In addition, please recognize that people may respond differently to ketosis, and there isn't one recognized universal response. The study is called Association of a Low-Carbohydrate, High-Fat Diet with Plasma Lipid Levels and Cardiovascular Risk, and was published in the Journal of the American College of Cardiology, so a pretty prominent cardiology journal. Now, what they did was they evaluated data from the UK Biobank, which is this large collection of individuals in the UK who agreed to be followed over years, or even decades, with labs and health histories and outcomes and so forth. So it's an observational nutrition epidemiology study, which is pretty well recognized as a low-quality study. Now, these studies are good ways to evaluate large numbers of people, like tens or even hundreds of thousands of people for long times, years or decades, things that are very challenging, if not impossible, to do in intervention trials. But as we'll describe, these studies have lots of problems that make it difficult, if not impossible, to draw meaningful conclusions from them. But here's the first point, and it's a problem that we see over and over again. So they define low carb as less than 100 grams of carbohydrates or less than 25% of calories from carbs. Now that's certainly low carb compared to the average person in the UK or the US, but it doesn't make it a true low carb and certainly not a ketogenic diet. A ketogenic diet is usually less than 5% or less than 30 grams of carbs, with low carb being, less than 50. So this study was less than 100, which is obviously not ketogenic, right? But the problem is, much of the medical community seems to assume that all low carb is the same. And if there's a finding at 100 grams of carbs, well, it must be the same at 30 grams of carbs. But this is simply untrue because that ignores the metabolic and physiologic shift that occurs with ketosis. Our bodies actually change from burning glucose for fuel to burning fat for fuel. So there's this complete transformation in our metabolism. And as an interesting aside, we haven't gotten into the results yet, but when this study looked at only those who ate less than 50 grams of carbs per day, the findings that they're touting were no longer significant. So the headline could have equally as been, quote, "No difference in cardiac events for people eating less than 50 grams of carbs per day." But that wasn't the headline. But I think it's important to note that we should conclude that if the intervention isn't ketogenic, then the data doesn't apply to ketosis. It's as simple as that. But another problem is that there isn't much of a description of what kind of carbs people ate. So one of the benefits of only eating 30 grams of carbs per day is it's hard to fit in a lot of the ultra-processed or refined carbs. Most of the carbs come from, vegetables and a little bit of fruit and maybe some nuts. But when you increase that to 80 or 100 grams of carbs per day, all of a sudden there is more room for those products and, which we know have adverse health effects. So accounting for that is crucial, which is something this study didn't do. So we could stop with our analysis right there, right? Say it's not a true low-carb study, but here's another key point. The majority of the participants filled out one 24-hour food diary. One, that's it. After a decade of follow-up, there was one food diary. And the paper even mentions that, only one sample may not accurately represent what the participants really ate, but that's what they had. So that's what they're basing all these conclusions off of. Now, let me ask you, does that sound like an accurate way to assess how someone eats, especially over a decade? No, absolutely not. I don't think so either. So again, we could just stop right here and say, look, the data collection is really suspect. So we strongly have to question any results or conclusions from the data. But there are more things to talk about. And the next problem is another big one. It's called the healthy user bias or unhealthy user bias. Those who ate lower carb had higher body mass index, were more likely to have obesity or diabetes, and more likely to smoke. Now, the researchers can try to statistically account for these things, but that's often inaccurate. And they absolutely can't account for the fact that the subjects simply were inherently less healthy. I'd really like to see the same study with a true low-carb diet and people who were thin and metabolically healthy following low-carb and were proactive about their health. My guess is that eliminating the unhealthy user bias would dramatically alter the results. So let's look at it another way. So another important point is that really there wasn't a clinically significant increase in LDL between the groups. It only went up like 3 milligrams per deciliter on average in the low-carb group. So should we proclaim that the study proves low-carb doesn't meaningfully increase LDL or ApoB? No, we can't conclude that. We can't agree with the results that fit our biases and discards the one that don't. In a study like this, we pretty much have to discard all the results, unfortunately, including the LDL data. They didn't study a true low-carb population, and we have no idea how they ate over a decade. So how could we conclude anything about the way they ate and their LDL? We can't, just like we can't believe the cardiac event data, unfortunately. And the last point I want to make today is the magnitude of the results. The hazard ratio for eating low-carb and having a cardiac event was 1.3. So they were 1.3 times more likely to have a cardiac event. Now, I like to point out that the association between smoking and cancer was between like 15 and 30, depending on the study. Not 1.30, but 30. So that puts it into perspective, sort of the paucity of these findings. So as a physician, how in the world can I take the results from a study with such flawed methodology and very marginal results and pretend that they have anything to do with the patient in front of me? I can't. It's simply meaningless results for me as an individual or the individual patient I'm working with. Now, some may say, but look at the totality of evidence, right? There are other studies that show the same thing, and there are. One with the same methodology flaws and meager hazard ratio that define low carb as less than 37% of carbs. So it was even less of a low carb study. And another that only showed a very small rise in LDL and used 25% of carbs and had no clinical outcomes. So yes, there are other studies, but it's the same poor quality science. So if someone really wants to study the effect of ketogenic diets on cardiac risk, they should test ketogenic diets, not quasi-low carb diets, and they should test it in a way that doesn't guarantee healthy user bias. But this study didn't do that. So it's frustrating to see people claim the data show as if that's the end of it, right? But what's the quality of the data? That's the question that we're missing. So should we agree with the tweet about this finally being good science? No, exactly the opposite. But I don't know, maybe it's worth the thought experiment. Why do some people tout this as good science or talk about the results as if they're truly meaningful? I mean, I think we all have an element of confirmation bias. We promote studies we agree with and put down those we don't. Maybe I'm doing some of that right now. But I think what we all need to start doing is using language that's consistent with the strength of the data. Is there an impressive anecdotal report or a small case series? Well, that's great. Call attention to it. Discuss how it could fit for some people and call for more research, right? But don't assume the same results are going to apply to everyone. And for a study like this one that we're discussing today, we should discuss it for what it is. And it's not good science. It's not a definitive study. It's a Swiss cheese of a study that we can hopefully learn from its weaknesses and design better studies in the future. So I hope this helps you better understand science quality, better understand how to interpret these results. And if it was helpful, please like and subscribe, and please leave a comment. We would love to hear what you think about this study and nutrition science in general. So thank you for watching. I'm Dr. Bret Scher, and we'll see you here next time at Metabolic Mind, a nonprofit initiative of Bazooki Group.